Welcome everybody. My name is Valerie Florence. I head the grant programs for the National Library of Medicine, and I'm really thrilled to be here to introduce the speaker in the first of our grant series. You see the title. I'll say a little more about the project and the speaker, but first I'll just give you this picture. If you're an NIHer, you might have seen this before, this kind of word cloud that reflects the kind of work that Dr. Nguyen's been doing. And you might say, well, how does that fit in with NLM, right? And it does fit in with us. We support research and development with focus on methods and discovery in a whole bunch of areas, but especially thinking about the tools and the information resources that will really pull together this whole world of information that we need to understand our own health and get healthier. So, our concept always is that collections of health data could be used, and you could use them for any number of reasons: reducing bias, building data-driven portraits of personal health, quality control. So let me tell you a few things about Dr. Nguyen. Excuse me, allergy season. Learning to use my shoulder anyway. So as you can see, as you saw, the title of the talk was Using Google Street View Images to Examine Links Between the Built Environment and Health. And advances in neighborhood research have been constrained by the lack of data, right? It's hard to get neighborhood level data for many geographical areas. I know you were working in Utah. I used to live out there. So just trying to get from one place to another was a big challenge. She's going to discuss the use of Google Street View as a source of national data on built environment features, and then the use of computer vision to label images that can give indicators of things like walkability or urban development. Dr. Nguyen is an assistant professor of epidemiology and biostatistics at the University of Maryland School of Public Health. Not that far from us, just saying. She's a social epidemiologist focusing on contextual and economic factors as they relate to health. She has extensive experience using numerous national and international population-based health surveys to examine social and economic predictors of health. Her current research focuses on, as we're going to hear about more, neighborhood indicators, creating and validating them. In a recent publication in Preventive Medicine, she and her co-authors explored the relationship between business patterns and health patterns, and using data from a variety of sources. One example was finding an association between full-service fitness centers associated with decreases in obesity and diabetes. Okay, so that tells us what to be doing after we leave here, right? She has more than 30 published articles on topics such as food access, effects of the built environment on health, and social determinants of health. So I'm not going to talk anymore. I'm going to invite her up here to speak. Dr. Nguyen.
It's really an honor to be here to present on this research. We are supported by NLM, and I feel like my whole career has been quite supported and by NLM. I got a KO1 from the Big Data to Knowledge Initiative, and that was housed in NLM, and we've moved to the R01 mechanism, which is, we're in our second year in this Google Street View project. And so I'm going to be discussing the studies that we've done yet to date using this data source, but at any time, feel free to raise your hand with questions or comments. I'm happy to welcome them. So Google Street View, it's a relatively new resource launched in 2007. It's characterized by high resolution images and panoramic views at the eye level. So this is in contrast to other image data such as satellite imagery, which is overhead imagery, and overhead imagery is not as good for if you're interested in neighborhood research as compared to eye level views. Google Street View has many advantages. For instance, it has a consistent methodology that it's used to collect images. So even though you as a researcher are not collecting it, it's going to be universally applying this to geographies across the United States and across the globe. So the images are collected typically on a car with special cameras, and they take panoramic views of the location. The one downside of using this data source is that Google will have different frequencies of update depending on the area, and that's constrained by weather, population density, and also road conditions. So, for instance, if the Google car can't go down that road, then there's going to be few, if not any, images for that location. So that's a caveat. So I'm going to first go through the pilot of this project. So the aims were to use this publicly available source to kind of leverage that to make it a cost-efficient and sustainable project, and then to try to derive built environment characteristics and examine demographic relationships and also health outcomes. So the methods, we picked 3 cities that were geographically dispersed and also visually distinct. So we picked Chicago, a big city, Charleston, which is a more rural place, Charleston, West Virginia, and then Salt Lake City, which is an in-between. It's like a medium-sized city. At each location, we sampled images at the road intersection and also along the street at intervals of 50 meters. So this is in contrast to lots of neighborhood data where you only have data on certain cities like Boston or New York, and even within those cities, they might only inventory a few blocks or a segment of that. And so using a big data resource allows you to cover broader geographies and then to examine broader links to health. And so we picked these 3 cities in order to answer the question, can computer vision process images that visually look very different? So it kind of demonstrates feasibility of the project. And we selected 3 indicators. The first one is crosswalks. That's like an indicator of walkability. The second is building type. So that is an indicator of mixed land use, which is a classic indicator of generally mixed land use is associated with better health because people are located closer to their amenities. And the third one is street greenness. Ample street trees and street landscaping, which has been found to be associated with better mental health and physical activity. So one thing about these models, we use supervised machine learning models, which require manual labeling of data. So it requires a training data set, and we labeled close to 16,000 images, and we made sure that inter-rater agreement was 85% or higher for each of the indicator. A portion of the data served as the training set and another portion served as the test set. So we use deep convolutional neural networks to perform object recognition. So this is one of the gold standards used for object recognition. And when we worked with our engineer, he had only processed medical imagery, so neighborhood imagery was entirely different. And so it was also like a learning curve to kind of use the tools, but on a completely different set of research questions, but it was doable. And so for each of the indicators, we achieved up 85 to 93% in accuracy. That just means the agreement between the manual labels and the computer vision labels. And so that was quite satisfactory for us. That meant that we didn't have to label, for instance, 50,000 images, that we can rely upon the computer vision models to do that for us. And so these are just some sample images of our indicators. So street greenness, so this, there are street trees and lawns, so this would be labeled as a green street. There's a crosswalk, and we see a building type that's not a single family home, so this is a mixed land use community. Here, there's only 2 trees, so we didn't label this as a green street, and there are no crosswalks. And this is not a building type other than a single family home is present, so it's also mixed land or non-residential. There's also another good point. So for street greenery, you can do like a color analysis where you can say a portion of the image that is green. But here we kind of chose a different technique where it would be able to recognize that this is a green street even though there are bare trees. And we had even starker images where it was a winter scene and it would still be able to identify that that's a green street. As long as you have the training data labeled, look, this is a green street, the computer vision model can be trained to incorporate winter scenes, given that the Google Street View cars drive down during different seasons. So these are descriptive statistics across our 3 cities. So the most green city is Charleston, West Virginia. The place with the most crosswalk is Chicago. And then Chicago also had the most mixed use at 55% of images having a building other than a single family home. So with these data, you can create maps of the distribution of images. So here are maps of the distribution of features across Salt Lake City, and below are sample images from Salt Lake City, and kind of see for different features there's more concentration of features in certain areas. So it's unequally distributed across an area. So you can kind of see visually what does your feature look like and how is it dispersed or is it unequally distributed. And these are images for Chicago. And one thing about Google Street View is because the images are collected for latitude and longitude, here we show maps by zip code, but you can actually create maps by any geography that you would like, so census tract or even specific neighborhood boundaries that you construct. So sometimes you have planning districts or community districts, and that's all possible if you if you have the shape files, and you can construct the neighborhood boundaries around that. So it gives you a flexible data resource that can map easily onto different cities and different towns. And this is Charleston. So Charleston looks very distinct. We initially had only used training data from Chicago to try to predict in Salt Lake and Charleston, but we realized when we ran the model for Charleston that the accuracy was dipping, and so we labeled data for Charleston. So that is a note. So the training data becomes very important. So if you're able to feed in as much variation or heterogeneity as reflected in the data that you would use, that is best for the model. And Chicago didn't have enough variation to cover what is found in Charleston, because Charleston looks quite distinct, and so we had to provide more training data specifically from Charleston. But I would say the whole training data set was created over a period of 2 months, mainly 1 month, and it's spilled over into the second month, so it's still very doable. You just have to kind of be very specific in what features you want, and then the definitions have to be pretty easy to be operationalized, and then with that, then becomes quite a simple and doable task. And then I can after I go through the presentation, if you have specific comments or questions about the behind the scenes weeds and like that we encountered, I'll be happy to go into those details as well. So for demographics, across the 3 cities, we were finding that higher median income was associated with more green streets and more mixed land and fewer mixed land use. So so higher income areas mainly just had houses. So this is probably the suburban areas. And then we linked that with a very special data set, the Utah population data set, which I haven't really encountered another data set quite like it. If you are in the state of Utah, you probably are in this data set. It has administrative data, so it has DMV records, it has birth records, it has divorce records, it has data contributors from clinics, Intermountain Healthcare, as well as University of Utah. And so all these data are linked by a study ID, so the researcher doesn't have access to identify information, only the ID and then the respective outcomes. So our question was, so where a person lives here we use zip code as a definition of neighborhood. Does that influence their individual level obesity and diabetes, controlling for their individual level characteristics as well as other zip code characteristics? The zip code characteristics we control for include population density, percent of population 65 years and older, percent Hispanic, percent Black, median household income, percent living there for more than 5 years. For individual level characteristics, we control for the age, sex, race, ethnicity, education, marital status, so the core social demographic characteristics. And even then, we saw that, for instance, people living in zip codes with the most green streets saw a 27% reduction in obesity. And these kinds of associations were similar. So if you wonder what effect size, they're generally in line with demographics. So the effect size for demographics are kind of similar to what we're seeing for these built environment characteristics, except that poverty and like SES is, we saw that that was like most correlated with these outcomes. But then demographics and built environment features were like this next level of strength associated with outcomes. So for these features, we saw green streets, crosswalks, and mixed land use were associated with reduction in obesity and diabetes at the individual level. And this is taking in data from over 700,000 people in Utah who are 20 years and older, who are Utah residents. So the pilot data, the pilot study was demonstrating, can computer vision be used to try to extract built environment features from areas that look very different? And then does built environment characteristics, do they correlate with health? And it seems like it does. The computer vision models perform with a good level of accuracy, and it looks like it is being associated with important chronic conditions, even controlling for predisposing characteristics. So image data can only capture a subset of community features, so we can't capture things like crime or noise. And then also computer vision, because we built a model for each indicator, that is different from, for instance, a neighborhood inventory that has hundreds of features. So if you have like a staff member going to a neighborhood, they typically have a clipboard and they're going to inventory for hundreds of features potentially. But it would be very difficult to build several hundred computer vision models because you have to provide training data for all those indicators. So it kind of restricts on the type and extensiveness of the features that you can pick. And also, this is a cross-sectional study that we presented on, but if you had longitudinal data, you could do longitudinal analyses, whether changes in neighborhoods predict changes in health outcomes, for instance. And I would also say we did a sensitivity analyses with the Utah data set and to even do a more extensive control of confounding. So we looked at one unique characteristic about the Utah population database is they have family relationships. So we looked at siblings that share, of course, family factors, but live in different neighborhoods. And so even in those analyses, we saw that these predictors were associated with differences in health outcomes in the same direction. So even taking out family background factors, it seems like built environment was still playing a role in chronic conditions. So ongoing work. So we've since then expanded due to funding from NLM to be able to do that. So we've expanded the number of indicators we're creating. So now, for instance, we're looking at single lane, visible wires, as well as other indicators of physical disorder. We use some of the training data that we had, and this is just a representation of the deep learning network. And some of the new images that we've collected. So the second round of data collection, we collected 32 million images from across the United States. And these are just some of the features. So green 30, crosswalk, not single family home. This is a single lane road. And then we don't see any visible wires. Here's an image where you do see visible wires. It's not a green street. We don't see crosswalks. We don't. There are buildings that are other than a single-family home. Here we have some more features. So this is the type of images that we collected. across the different neighborhoods. So from the 30 million or so images, this is like a summary of the distribution of the features. So most images were labeled as being green streets because the United States is a very most people are concentrated in urban areas, but a lot of America is rural, and so this is kind of picking up that as well. Crosswalks are only prevalent at around 7%. We have buildings that other than non-single family at 30%. Single lanes were present in about 55%. Visible wires were present in about 61% of images. And so we linked the 30 million images with county outcomes from a variety of sources. So the exposure is using data and techniques that are a bit foreign, a bit new to public health, but the outcomes come straight from traditional data sources such as the CDC Wonder mortality data, the BRFSS. And so even though I was personally trained in health surveys, so the one component is new, but the other component is still very classic. So we linked the Google Street View images with county health outcomes to order to see the relationships. And we're looking at crosswalks, non-single family home. So crosswalks are generally associated with better health. So walkability has been a pretty robust predictor of better health. So lower chronic conditions, lower mortality. Not single family home we found that it's mainly an indicator of urban development, and it's kind of picking up the rural-urban disparities. So it's generally associated with places that. So not single family home is picking up, for instance, closeness to amenities, and it's associated generally with better outcomes. Single lane is picking up indicators of urban development that's generally associated with. So places that have more single lane roads are less developed and generally see worse outcomes, with the exception of two domains. One is sometimes we see places with less urban development having less mental distress, so less distress and less binge drinking. But it'll be associated with rural areas would have like more chronic conditions, but less distress and less binge drinking. And then visible wires is a completely new indicator. There's not much literature on that. It poses two potential risks. One is electrocution, and two, physical disorder. And we've seen generally that it's associated with worse outcomes. And here we're linking our data with the 500 cities data set, which is a relatively new data set. So it has data for 500 of the most populous cities, also in addition, like other locations to have representation across the U.S. And we link our data with their health outcomes. We're seeing, for instance, that not single-family home when indicator of mixed land use is associated with, for instance, lower physical inactivity. Visible wires is associated with more mental distress and more physical inactivity. And one of our next steps is to link our health outcomes, our Google Street View data with clinical data. So we're linking with Intermountain Healthcare data as well as UCSF patient data in order to see individual level patterns. We're also linking this with NHANES and NHIS data. So we've already received approval from the RDC, the Research Data Center, to link our Google Street View with that data to understand these patterns at the individual level. And so those are the next series of analyses that are planned. So clinical data as well as health survey data that have geotags. I also wanted to make a slight comment in case you wanted to take a different approach. So the approach that I described was looking at particular built environment features. So if you had indicators of walkability or physical disorder in mind and you want to extract that feature, you kind of take the approach I would take. But if you wanted to just predict on the outcome, so for instance, obesity, you can actually do that with a direct approach. So where you ask the computer vision model to kind of try to identify and find the array of features in the image that would predict obesity, for instance. So we tried doing that, and the coefficient variation was around 49%, so meaning that 49% of the variation in obesity or census tract obesity could be predicted by just looking at the features in the image, so the built environment features in the image. The only downside with this method is that the model doesn't tell you what features it's looking at, so it's very black box. So it can say, I predict that this is going to be a high-risk obesity community, but then you have to kind of look at the high obesity community images and the low-risk community images, try to like tease out, okay, what kind of features is the model think that it's correlating with obesity. And so there's kind of qualitative work behind the scenes, but it kind of takes outcome and tries to model that. The most recent data collection, we have now 170 million images, so in total over 200 million images from across the United States. And we're processing it for indicators, the previous indicators I described, as well as new indicators. So sidewalks, that's the newest, for sidewalk indicators, we're getting accuracies above 85%. For physical disorder, that's an indicator that is quite difficult because physical disorder looks different across different communities. And so one thing about computer vision models is that it predicts best if you have a very standardized looking feature. So for instance, sidewalks or crosswalks, so something that looks the same. But if you have something like dilapidated building or just like physical disorder scale in general, we're in year 2, so we're kind of trying to tackle the meaty, difficult indicators, and that's what we're going to work through. So that's a very complicated indicator, and we'll probably have an update in a few months about how we're tackling that. Right now, the accuracy is not that good. It's around 46%, so that's quite not the same level as crosswalks or sidewalks. And that's because dilapidated buildings, for instance, look very different. Because it could have a broken roof or like boarded up windows. So just as FY, the more variation a feature has, the more difficult the computer vision model is going to have with that. But we're excited about having this very large data set to work with that covers across the United States and gives you a fine level look into the built environments, and then we're able to look at national patterns and health outcomes, as opposed to just looking at one neighborhood at a time. And the final goal of having this data set is we eventually will release it to the public, and so the public can merge their data with our data and continue the impact of this and have it be available, a new data resources for researchers out there. So I would say the advantages include efficiency, research safety, because, for instance, you're not sending people into neighborhoods that are dangerous, low cost, and then you're, because we're doing this in a virtual manner, we're not interfering with like day-to-day life of residents, so that is those are quite good benefits. The limitations include the different time frame of the data collection, so images, even at one intersection. So we collected 4 images per latitude and longitude, so that way we can have a 360 view of any latitude and longitude coordinate. But sometimes the different pictures would be taken at different times. So there could be temporal lags, or that you have to kind of think through and account for it when you're looking with health outcomes. There are advantages of being on site, because being on site offers you context. Here, you're looking at images kind of distinct from the other. Like if you're in a neighborhood, you can look at, like, walk down the streets, kind of understand more of the context. But here, there's a more detached view that you have, and you have less information on the surrounding than had you been there in person. certain features are difficult, such as pedestrian detection, because Google Street View will protect the identities of people in images by blurring faces, for instance, and difficult objects to detect are small objects or objects that change with time. So if you're looking at features that have some kind of temporal component to them, then that's going to be more difficult to, or small. And sometimes you can have parked cars blocking the object that you want. So that's something to consider as well. And because you are working with the image that they capture, you can't, it's difficult to try to see features that are obstructed. And the streets are not that are not accessible by Google cars can't be captured, and this is a disadvantage, especially if you're interested in rural health, because we were finding that pictures from rural areas are older, and they're although we try to sample at 50-meter intervals, sometimes in rural areas the image is not available, and so the distance is actually greater than 50 meters. Yep. So also some other caveats. Currently, Google Street View has started charging for Google Street View images. At the time of the proposal, it was still a free resource, but now there is a cost associated with it. And they do have differential coverage. But I would say the cost is still relatively, doesn't make it infeasible. And the benefits include cost efficient, I feel the projects are still cost efficient, and they provide high level views of neighborhood features. So those are my slides, but I'm happy to, if people had questions about how we carry on with this project day to day, or like any of the everyday difficulties we encountered, or I'd be happy to answer questions.
So, questions? So have you had a chance to go out and into a neighborhood somewhere and talk to people about this?
Oh, yes, that's an excellent question. So we are partnering with teams that do neighborhood audits to try to see if our results would correspond with there. And the first project is a New Jersey-based project. And so for sidewalks, it's like they correlate very well. And we're working through the dilapidated building one indicator, which is kind of more difficult. But yes, that's like an excellent way to try to also leverage existing data. So people have manually labeled and audited neighborhoods, and so that can provide training data for our model. So we can it's also a quality control kind of experiment where you look at what are the different qualities of like manually labeled data, and like the ability of computer vision to predict the same indicators to the same level.
I could just imagine a community getting kind of interested and understanding itself this way, right? And thinking about it for community planning.
Yeah, exactly. Like tallying the number of crosswalks in that community, then you wouldn't have to go through the city and count all the crosswalks. We could.
And you mentioned that now that Google's decided this is valuable data and they need to charge for it, are there situations in which you think it would be worth hiring someone to do something similar, or is that even possible because their approach is, I don't know, proprietary?
Yes. So with like so Google charges for any use beyond $200. So I think each user is credited $200 to use, and I think in our work we find that equals about 18,000 or 20,000 images a month. So if your work happens to fall within that scale, it's still free to use. So that's still feasible. For instance, if you're only looking at a particular neighborhood or a few blocks, or even if you want the whole city, it will only take maybe a few months to collect the data at no cost. And so that is still a resource there. But just if you go beyond that, so if you're looking at the national scale, then you'd have to probably build in some pilot data to accrue those images. I would say that it takes a very interdisciplinary team to do this work, I would say the three main expertise include geography, engineering, and then public health. So those three are essential because without one, it would fall apart. So without engineering, you couldn't have the computer vision models, but without public health, they wouldn't know what features would be informative of health. And then without geography, you couldn't do the sampling at a national scale or even at a city scale. So I would say those three expertise are quite needed to run this project. Oh, yes.
Hi, I used to work down the street at Fannie Mae.
Oh, very nice.
And there, in particular, there was a group that did a lot of thinking around how geography affected affordability. And they were thinking a lot about the urban versus rural dynamic. Mm-hmm. Could you see incorporating housing affordability data, say from something like someone like Zillow or the Harvard Center in a model like this? Because it seems like you've got the geographic element, you have a health outcomes element, you have an income element, and then there's an additional measure of affordability that would say, well, these are neighborhoods that might be middle income or high income, but the housing price is so high that kind of affects universal health outcomes.
Yes, that's an excellent suggestion. Affordability, and that kind of gets into the perspective of access, right? Because different populations have different access to health resources. If we consider built environment as one type of health promoting or health discouraging feature, and we can kind of do like a map of like, so these neighborhoods seem to be high quality or supportive of health, but they are the most expensive, for instance. That could help inform policies about how important affordable housing policies are, because without them, they wouldn't support access to better neighborhoods, and so then people will be priced out of like the most healthy, health promoting neighborhoods. Yes, that's quite excellent point. Yes, I think I've also heard the suggestion of using like Zillow to try to look at gentrification, so that the ballooning of housing prices and how that can affect health outcomes in communities, displacing communities. So using that kind of data resource, kind of like thinking, because I work in the space of big data, but Google Street View is one data source I use, and we also use Yelp and business patterns data and Twitter. And so I'm always thinking about like, what is the most appropriate data for the research question, and there's a lot of data out there that we could leverage to answer public health questions that are very kind of non-traditional but still very useful. Zillow and the housing prices are quite an excellent example of that.
I found your direct approach, trying to predict obesity and other health factors straight from the images, very interesting. But as you point out, of course, it's very difficult to figure out what the model is using to predict. Sometimes with these classifier models, you can, if you superimpose all of the images from, like, say, at one extreme, like the most obesogenic or obesity predicting images, you can get an idea of what features they're using. Exactly. Have you tried that kind of approach?
We haven't. The direct approach has relatively been a new, those are relatively new results that we have yet to unpack, but exactly kind of looking at the category of images that are predicted to be most obesity prone and qualitatively extracting the indicators. But the indicators that we found so far that seem to correlate well with obesity include walkability and lower neighborhood disorder and also greater urban development. So those are the kind of features we find that correlate with obesity. But it would be good to kind of qualitatively look at the images to try to see if there are other indicators that we're especially missing.
Yeah, because it would be interesting to use that to find features that you didn't already know about.
Exactly.
That seems to be like that would be the value of these kinds of models.
Yeah, exactly. I will make sure to kind of make that one of the priorities, because we have the data, but we to try to unpack those results.
So I think you said you were thinking about adding clinical data.
Yes.
Are you also thinking about like where the healthcare is located in the community and stuff like that?
Yeah,
not that it's easy necessarily to tell what used to be a hospital that's now an emergency room, but you might be able to.
Yeah. Previously, before we use other agencies' data to try to that kind of capture the availability of healthcare access. So, like under-resourced areas, like the distance to the clinic or like the density of primary care or mental health services. But we haven't tried to extract that from built environment images in particular. But I wonder if like that's another thought, empirical study to try to compare. So this is what the agency's data tells us, but is Google Street View more updated to try to capture even more recent changes, for instance, in the healthcare? Because the clinics can close and open.
Yeah, I just keep thinking of all this back.
Yeah.
I'm also thinking about the neighborhood I live in that has single lane highways.
Yeah.
And wires,
Yeah.
sort of,
Yeah.
right? Because lots of them are underground now.
Yeah.
And that's a suburban area, right? So it's quite different from what you're talking about, I think.
Yeah.
Now, in some of these cities, obviously, there would be neighborhoods like that, too.
Yeah. Yes. I think another quite complicated question that you kind of hinted at was or in the next steps is to look at like geospatial variation in associations. For instance, the indicator green 30, because our study was looking at relative cities. So Charleston, even though it's not a big city, it is still somewhat urban compared to very, very rural communities in the United States. But we're finding that now that we have images from across the United States, that green 30 is correlating quite highly with rurality. And so in a city, green 30 is associated with better health because you are exposed to more landscaping and greenery, which is generally like benefiting mental health and physical activity. But because it's correlating with rurality across the United States, it's associated with worse health outcomes if you were looking at just like a relationship. So looking at features and how the relationship changes across the different areas. And in particular, we're also struggling with because a lot of neighborhood research is focused around cities and urban environments. In particular, paying attention to rural communities and what features are going to predict their health has been a struggle beyond identifying access to amenities. So beyond access to amenities, what other features are associated with health? Because, for instance, the park access, the parks might not be built up very well, and there might not be sidewalks, and a lot of cars. It's the main mode of transportation. So it's kind of thinking through rural health and what features to predict are going to be predictive for rural health. It's also what we're going to try to work through in the next series of years. But definitely welcome any comments, suggestions regarding that. It's quite difficult a kind of research question to tackle.
Any other questions?
Oh, yes.
Go
Hi,
ahead.
thanks for a really interesting talk. I have a question, and you probably mentioned, actually I have two questions. So the first one you probably mentioned. So you said that you looked at intersections as well as the random segments.
Yes.
Did you notice any difference in the results depending upon the intersections and random segments?
Yes. So that's a really, really great question. So some analyses, we only look at intersections, especially in the second wave of data collection. We're like, maybe we can just collect intersection data. But intersection data tends to pick up the types of like businesses. So you kind of picture an intersection, you have like, okay, these are the businesses in this community, like those kind of views more. So then if you walked along a street segment, then you're more likely to look at like the housing features, so the residential features. So if you're interested in kind of like business patterns and like crosswalks and signage, intersections might be where you want to focus your data collection. But if you want to look at residential characteristics or styles of homes or housing conditions, then street segments become an important component of your data collection.
And a second question. My second question is, do you know if there's any data about traffic? Maybe like about how traffic may be affecting these results?
Yes, we try to capture that in a few ways. We initially try to capture that with like pedestrian and detection of cars, for instance, and then also the number of lanes, although that's not a perfect correlate. So in communities with like more lanes, then we're assuming that there's going to be more exposure to air pollution in cars, for instance. But I would say if you don't want to necessarily use computer vision models but are still interested in traffic and air pollution, there are other data sets, especially air pollution monitors, and working with our geographer there, they have access to the types of roads that are in the community. So like they know the classification of small versus highways, small roads versus highways. So they already can tell you what kind of roads are present in certain communities, and so you don't necessarily need computer vision for that. If you're interested in just trying to capture like small roads versus like highways, but beyond that, if you want to detect the number of cars, for instance, that are along a road, then computer vision might still be helpful. Yeah. Mm-hmm.
Anyone else?
You mentioned Google Street View images and identification of any standard crosswalks or sidewalks. I'm just curious if GSV can, as a data source, can be applied to cities like Minneapolis, maybe, where it's entirely skywalk system, right?
Yes.
Yeah, so would a data source like GSV be translated to other cities with different?
Yes.
It's fully sidewalks, Minneapolis, for example.
Yeah.
I believe it's the largest skywalk in the United States.
Yes, that's a very interesting question. My first instinct is to probably, it might not, because they don't have Google Street View cars unless they happen to know that Minnesota is special and actually sent a different methodology to try to cover that. But Google Street View has some images of indoor spaces. That's a relatively new component, which we haven't really processed yet. So some Street View images are available for the inside of businesses, restaurants, stores. So they might be able to capture if there is a skywalk there, but I don't know how good the coverage is. But that is also one possibility. I would say with the sidewalk indicator, there's another caveat too. So within cities, you might have, especially for certain cities, have a lot of sidewalks. The model needs variation. So if the class is like overwhelmingly like 90%, then it becomes a little bit difficult to provide it. If you're taking a representative cut of your data, sometimes it's difficult to provide it with enough cases. But then for sidewalks, I think nationally, I think we're finding it. It has enough variation that the model is going to be able to detect cases and non-cases. The training data is something that we think a lot about, and indicators like graffiti is what we were interested in, but we found that there's not that many cases of graffiti that we kind of have to like we try to just label a random sample of images for graffiti, but we're finding that it's less than 1%, and so we kind of have to change or kind of like get to know your data and kind of learn what are some strengths and what are some kind of hurdles to work through with the different features. Mm-hmm. Yeah.
Thank you.
Of course. Thank you.
Any other questions?
Hi, thank you for the interesting talk. So I heard that Google has recently rolled out a new feature in Google Street View where you can view historical images.
Yes.
So I was just wondering if you were thinking about using that data to maybe look at longitudinal changes and see maybe if changes in environmental features correlate with changes in health features.
Yes, that's an excellent point, and it also would make the study design stronger, because then you would see like, okay, changes in built environment actually correlating with changes in health outcomes rather than performing like cross-sectional analyses where the direction of causality might be more limited. The only potential limitation of that is that the platform itself, you can view it on your desktop, but the API that is used to download images only gives you the most recent image. So with the longitudinal analysis, there are teams that and we're actually collaborating with teams that have created like a virtual audit platform, which you kind of use to look through the historical images and then label them and correlate that with changes in health. But currently the API only gives you the most recent, so you have to use like a virtual platform to look at historical changes until the API changes its offering. But one kind of unique thing about Google is maybe because they mainly cater to businesses. One thing that I encountered was like they were hesitant for us to use data that was old, and what they think considered old was like 30 days or something. So, but that's outside research. 30 days is new. 30 days is hot off the presses. And so their mindset is different, like, you know, research versus commercial use. So the historical analyses currently are only available using manual virtual audits, unless the API changes. But it's still very possible to do and people have built platforms and inventories for that very purpose. So it's very feasible research to go.
Hi, thanks for the talk. I was wondering, in your preliminary study, if you compared these features like green space and sidewalk with any municipal government data. And then you mentioned graffiti is something you wanted to identify, but what other features might you want to look for that you couldn't find from municipal data?
Yes, I would say one good, I didn't really get to cover, but it was an additional study that we did using Google Street View API. So Google has its own computer vision API, and you could use it. And it's actually because of cloud credits we received from NIH that enabled us to test out their API for computer vision purposes. And we released the API on our Google Street View images. And what we're finding is that it's able to kind of characterize things like urban development. So it labeled images for highway, grassland, rural area. And then we correlated with other indicators of urban development and rurality. So the USDA, for instance, codes and like population density. And we're finding that the directions of the associations were in alignment. So more urban development being generally related to lower chronic conditions, lower premature mortality, but sometimes worse mental health and worse binge drinking, higher binge drinking. And that's across using Google Street View or using the rural urban codes or using population density. We haven't looked at other features, except that other features kind of, we see Google Street View as being one additional variable in the data that is available. So we kind of don't see it as potentially being used to kind of cover all neighborhood features, but then just some features that are not available by other resources. But then looking at people who've done audits of neighborhoods, for instance, and trying to do quality control studies, that's very helpful. And trying to see whether it's, we did kind of see whether, for instance, business patterns were correlating with some of our built environment features. And so like, for instance, places that have more businesses are going to be correlated with the not single family home indicator because they have buildings that are besides residential homes, for instance. Was that, or I feel like I might not have directly answered.
I'll tell you what I can do that will help. We can say thank you to Dr. Kennedy, and then if you want to speak more with her individually, you're welcome to come up and do that. How's that?
Yes,
Thank you
that's
very
perfect.
much.
Thank you so much. Thank you very much. Thank you.